Hi, I'm Helen.
And I'm Talia, and welcome to another episode of Dose of Pharma.
Today, we're joined by Olivia Di Giovanni, who's a hospital pharmacist at Austin Health, and we'll be discussing the field of hospital pharmacy. So, to begin with, Olivia, would you be able to tell us a bit about yourself?
Yeah, sure. Well, thank you guys for having me on the podcast today. I'm Olivia, and I'm a hospital pharmacist at Austin Hospital, which is a large metropolitan teaching hospital in Melbourne. And I only just completed my internship last year, so I'm very, very junior in my career. I've had my general registration for only about 3 months now. I did my pharmacy degree through Monash, and then I also did my internship training program through Monash as well last year. Currently, I'm working as a pharmacist, so I stayed on after doing my internship. I stayed on at the Austin, and I'm currently working in an area in the hospital known as manufacturing, sterile manufacturing. So we are responsible for, making a lot of sterile products such as intravenous immunosuppressants. We also do lots of creams and ointments, etc. So that's where I'm currently at.
That sounds great. Thank you for sharing that. That's amazing. So what is the importance of pharmacists in the hospital setting, and what aspects of the role's values and workflow attracted you to a career in hospital pharmacy?
So I think hospital pharmacists are very, very valuable, and I probably didn't even realise the full extent of their value until I actually started working in the environment myself. But I would say your hospital pharmacist, generally your ward pharmacist, is the go-to person for a lot of other people on the ward. And I'll just provide a few examples. So, for example, you're the nurse's go-to when they have pretty much any question about a medication. They do come up to you and depend on you a lot throughout the day. They might ask you a question about, my patient can't swallow, can I crush this tablet for them? My patient needs this medication administered intravenously. Is it okay to be given with this other medication? So lots of questions like that. The junior doctors also rely on you a lot. So you're also the junior doctors go to a lot of the time as well, when they need help writing a prescription or when they need assistance, charting a new medication for a patient. So I think a lot of people depend on hospital pharmacists, and I think it is very nice to feel so valued and to work so collaboratively in that environment.
Great. Thank you, Olivia. That was a great answer. Just a follow-up question to that. So how have your personal experiences in the field influenced your interest as a hospital pharmacist?
So I think similar to what I said before, a lot of the time you don't even realise how much there is on offer until you step into the environment yourself. But I think my passion for hospital pharmacy has only grown. And I think where I'm currently working in manufacturing, I never would have thought that I would be, working in that space so early in my career. But it's really, really fun. And it's something that I didn't even know hospital pharmacists really did. So, you learn something new every day, and you learn different parts of the hospital, more behind the scenes parts of the hospital, which I'm currently enjoying.
I think that was such a great answer. I do get the same thing. So because I'm pharmaceutical science student, and when I first started to look for the jobs at pharmacy just as a pharmacy assistant, that was when I realized how different pharmacy is compared to pharmacy in my home country. And then you don't know that there are many, many new things and always things to learn until you actually start your position.
Yes.
And so I think that's a really, really good thing about pharmacy. And it's a good thing that we can keep learning new things every day. And so I guess what's something that you find really challenging for you when you first began your role? And what's something that still challenges you up until this point?
That's a great question. I did have to think quite hard about this question. I think time management to an extent. I think a lot of other so obviously a hospital is 24/7. It never closes. But I think a lot of other hospital workers, work shift work. So we'll use doctors and nurses as an example. So of course, if you come to the end of your shift as a nurse, for example, you generally have someone to hand over to. Whereas a pharmacist, in most cases, there's very few, I guess, areas of the hospital that have extended hours, but in most cases you don't have someone to hand over to. So most of the work that you don't get done for that particular day will generally fall onto you the next day. So I think time management is an important one, because you, I guess, need to come to the end of the day and feel like you've achieved enough in the day so that your work doesn't just like pile up throughout the week. I do find that a bit challenging. It's probably less of a challenge when you're an intern, because you do have someone supervising you. But now that I'm, I guess, standing on my own feet a lot more because I'm registered now, it's probably become even more of a challenge, but that's something that you just learn with time. Yeah.
And just a quick follow-up on that, because like hospital is open like 24/7, and then as you said, if you don't finish your work at the end of the day, then it will just like pile up the next day. What about like after hours? So when you go back home, do you have to like take work with you? Because like I heard that some people, they have like a pager, and then like when they go home, if something happens in the middle of the night, then someone could page you, and then like you can just like quickly deal with that emergency situation with your laptop, or like quickly contact someone at the hospital and give them directions. So is that the case for your role?
Yeah, so we do have an on-call pharmacist all the time. So we do have one on-call pharmacist, and they are on call for the entire week, and they work on a rotating roster. At my particular hospital, these pharmacists have at least, I think, sort of 4 to 5 years experience. So it's not something that I have to do right now. I do know that some other hospitals, from what I've heard, do have more junior people on call. But yeah, at the Austin, we have more senior people on call. And so, yeah, like you said, if something does happen overnight, if there's an urgent medicine that they can't source and only pharmacy keeps it, or if there's an urgent, let's say an IV immunosuppressant that needs to be made urgently overnight, then yeah, the on-call pharmacist will have to come in. So there is an on-call phone. So yes, pharmacy is contactable after hours, but most of the work does get done sort of in the main pharmacy hours, which are generally 8:30 till 5:30.
Right. So we've talked a lot about challenges. The next question that we would love you to answer is, what's the difference between reality and expectations?
So in hospital in particular, is that what you're wondering? In hospital in particular?
Yeah, in your hospital, and also like throughout your whole education, as an intern pharmacist, and also like as a registered pharmacist.
Uni does prep you quite well. They do try and give you, for example, in your OSCEs, you do get a range of different patient age groups. They do try and get you to interact with people that are, for example, maybe hard of hearing, or, have some challenges like that. So that is a good preparation for real life. But then, of course, you sometimes get patients who have English as a second language, or you get patients who are going through a really difficult time and just don't feel like talking to you at all. And you do have to manage those expectations. So sometimes when I go to do a history taking, I keep it very open-ended, and I'll just go up to the patient and say, hi there, I'm Olivia. Are you up for a chat, or do you feel like having a chat? Sometimes just keeping it nice and open-ended like that can create that nice, I guess, warm space. If the patient says no, then of course you have to be, compassionate, and you have to be understanding, and just say, that's okay, like I'll check in with you a little bit later on in the day, which is not always possible. Sometimes it might be the next day. But I think that's a good example of where sometimes the patient is not always up for a chat. So you do have to, I guess, restructure your day sometimes to cater for that.
That was a really great response, Olivia. I just have a follow-up question regarding that. So as a hospital pharmacist at Austin, are you like in charge of a certain amount of patients, or do you kind of just rotate between different patients, or how does it work?
So when you're an intern, we'll start with that. When you're an intern, you do have your intern rotation. So you might spend on average sort of 3 to 5 weeks on a specific ward under the supervision of that ward pharmacist. You do, of course, have your more operational rotations as well. So you rotate through outpatient dispensary, you rotate through manufacturing, which is where I am right now. But you do that as an intern, of course, as well. Once you register, since I registered, I was just doing like little covering stints here and there. So for pharmacists that were on annual leave, for example, I did little sort of 2-week stints until I landed in manufacturing about a month ago. And I should be here hopefully sort of for the next 6 months or so. Do keep in mind that every hospital works a little bit differently as well. And it depends on resourcing and staffing and where you're needed. But generally speaking, it is quite a rotational sort of job.
Okay, great. Yeah. Thank you so much, Olivia.
No worries.
We'll move on to the next question. So that is, what strategies did you employ early in your career that gave you an advantage whilst working towards your current role?
I think for me, I'm going to answer this more, it's more a mindset rather than a strategy. I'm going to take that spin. And I think perspective is what I always try and keep in mind. I think during your internship and going into your internship, a lot of people will say to you, it's so challenging, it's the worst year of your life. You'll hear a lot of that. And yes, it was very challenging. I won't deny that it was stressful and it definitely was challenging. But there's so many people before me that have done it. There are many people ahead of me that will do their internship, and everyone gets through it eventually because it is doable at the end of the day. You just have to, I guess, chip away at it slowly. I do think it's really important to try and maintain your sanity on the weekends as well as much as possible. So me personally, there were a handful of weekends during my internship where I just got out of Melbourne for the weekend, whether I went to Phillip Island or a different part of Victoria, just to get out of the city and just to have a change of scenery. And I found that very beneficial. And I have taken that into this year as well. And yeah, when I'm just feeling like I need a change of scenery, a sea change, or just try and get out of Melbourne a little bit. That's my advice if you can do it. And just keeping a nice perspective, I think, was very helpful.
Yeah, that's really great advice. Definitely. It's good to just take a moment to just kind of relax and just like go to a new environment. So that's amazing.
Just step away.
Yeah, exactly. Yeah. And on that point about intern year, so I was just wondering, did you do the Masters of Pharmacy as well?
Yes.
So how did you find that, balancing the internship and the Masters?
So you do start your Masters units in third year. Talia, you may be starting those, or you might be starting them next semester, actually. So you do start them as a student, and then during your internship to, I guess, complete your Masters, you do have to do a research project. And in my experience, my hospital was very, very supportive of that. We have quite a big research department, so lots and lots of support there. And you also have to, I guess, chip away at these different competencies and meet these different requirements. But a lot of those requirements you actually do in your day-to-day work anyway. So it's not too much additional work, if that makes sense.
Yes.
The large chunk of the Masters was the research project. And because they've been doing this for a couple of years now, most workplaces hopefully are quite equipped to support their interns in doing that.
That's really great to hear. So follow-up question. So what decisions did you make as a student that provided you with the upper hand once you got to the workforce?
Yeah, so I try to get involved as much as I can. And this is my advice to you guys as well. I think you got to ask yourself what you're hoping to get out of uni. I think you can just go to classes, rock up, and then go home. And if that's what you're hoping to achieve, that's completely fine as well. For me personally, I found uni to be a lot richer by getting involved in leadership activities, participating in the open days, being a student mentor, all of these things. So getting so heavily involved then, I think, set me up well for my internship because I already had to, I guess, refine that skill of balancing co-curriculars and study life. Yeah, that's what I would say for that.
Yeah, great advice.
Yeah.
So throughout your career journey and your intern year, have you had any mentor, and how did that shape you into where you are and who you are today?
Great question. I did have some mentors. Yes, I did. So some of them came in the way of my skills coaches that you guys also do at uni. So you allocated a skills coach each year. And personally, my skills coach in fourth year, for example, she was amazing. And she actually, for example, when I was applying for my internship, I asked her to proofread my resume and give me some feedback on that. So she mentored me throughout that process. I did also have a couple of mentors through getting involved in the student ambassador program at university, and I tried to catch up with my mentor. Sometimes when it was during COVID, it was just a Zoom call like this, an informal chat, but we often spoke about sort of what I was hoping to get out of the rest of my uni degree, what I was working towards during my internship. So having that mentor relationship was amazing, and I also learned skills through that relationship that I could then take on when I was a mentor myself to more junior students. So mentoring is a great thing. If you guys can get involved, I would highly recommend.
Yeah, that sounds great. I actually have a mentor as well through that ambassador program. She's a hospital pharmacist, so it's really great to have someone who's in the industry and who can give you advice and guide you. So definitely agree with that. Next question for you, Olivia, is for students considering a career in hospital pharmacy, how did you manage the pressures and expectations of such a competitive industry on the path to your current role?
This question did get me thinking, I have to admit. I think it's important to be realistic. You will hear this a lot. I think there, of course, are limited hospital roles, yet everyone has to do an internship. So realistically speaking, if you don't get into hospital, that's okay. You will still need to do an internship regardless. So you just need to work out, what environment you'd like to work in. And for most people, that's going to be community if it's not hospital. So ask yourself, are you enjoying your current student role? Do you see yourself interning there in that pharmacy, or did you have a really fantastic placement experience? Did you build a good relationship with your preceptor there, and could you reach out to them and see if they're taking on any interns? So that's my advice. But in saying that, of course, you do want to also give yourself the best possible chance of getting into hospital if that's what you really desire. And there's so many things that you can help to get you there. So for example, get people to proofread your resume. Like I said before, I got about 4 or 5 different people to proofread mine before I applied for my internships, from family members who aren't in pharmacy at all to pharmacy mentors. So get a nice different array of people proofreading your resume. Attend all the workshops that Monash hosts for you, or the Career Connect workshops. They're very valuable. And little things like dressing professionally, you'll hear it a lot, but it does go a long way. In your interviews, it does make a very good first impression. So all in all, my whole answer for that is be realistic, but also give yourself the best possible chance that you can. That's my takeaway.
Thank you so much, Olivia. I guess today we've learned a lot about hospital pharmacy and the advice that you gave. I guess the best takeaway would be really get involved in ambassador programs and activities at uni to really set yourself up and take the initiative and reach out to people, to seniors, to mentors, so that we can get advice and to get best advice out of it. So thank you so much, Olivia, for your time today.
No worries. Thank you guys for having me. Thanks so much for inviting me on. All the best with your studies. Happy to answer any questions if you guys have as well.
Thank you so much.
SOSA Pharma acknowledges the traditional custodians of the various lands throughout Australia on which we connect today, and pays respect to elders past, present and future.